Okay, this part is the actual care. This is a sterile procedure. You'll need your tracheostomy care kit. Depending on your hospital, you may use normal saline and peroxide or just the normal saline. This will always be a component though. Some hospitals allow you to use the peroxide. The thing that they want to be careful with is if you put peroxide on the patient's skin, to be sure and wipe that off with saline before you just leave it on there, because it can break down the skin if it's left for a really long time. Okay, so I'm going to open my kit. As you can see in this kit, your sterile gloves are in the way. And so there's lots of different ways that we could do this, but your faculty has decided the way that we want you to do this for your checkoffs is to try to get this drape out without touching the box and without touching those gloves. So you can push down and grab your drape and come out. Now, if you'll notice, I'm touching the part of the drape that is the edge, but it's also the middle. So I've contaminated my drape. The way this was packaged, the only solution that we came up with was to go ahead and open this and use the shiny side as your sterile field. We know that the shiny side is normally supposed to be down because it would prevent fluids from being wicked through. But with the package the way that it is, this is still sterile, and that's the way we're going to have to do this. The next step is to take these contents of this container and dump them onto this sterile field. You need to be careful of your 1-inch edge that is considered contaminated. So very gently dump your contents off onto there and lay this to the side. My hands are still just my hands, no gloves yet. I'm going to take my peroxide, check the expiration date, put the label in the palm of my hand, lip it if it had been used before, all those things that you know how to do. I'm going to put peroxide in one and a little bit in the big one. I'm going to take the saline, same thing, check the expiration date, make sure it hasn't been in the room too long, lip it if needed into a garbage can. I'm going to put saline in that second one. So we've got peroxide here, we've got saline here, and I'm making a mixture of saline and peroxide in here. Alrighty, so we're done with that part. Now you're going to get you some clean gloves. You're going to come over. Patient's oxygen does not have to be really high on this one because we're going to be replacing the O2 source and we're not suctioning. So we do want to replace the oxygen though every time we remove it. So I'm going to take the oxygen off. I'm going to take this inner cannula out, and we want you to stabilize the faceplate. As you turn it, it locks and you pull it out. See the wording on there says lock that direction. So I'm taking this out, and I'm going to put it over here in my mixture. I'm going to put their oxygen back on them. These are just clean gloves, so at this point I need to take these clean gloves off. You do not leave and go and wash your hands. You've got all this sterile stuff open. The washing your hands happened before, so all we did was take the oxygen up, take the catheter, inner cannula out, put it in there, so I don't have to run to the sink. I just need to come back over here. Okay, as you can see, my gloves are buried. Yay! Well, I'm just going to have to get them out. Still sterile. I just dumped it over. If you get it on the 1-inch edge, then you've broken sterile film and you need to start over. But I did a pretty good job. So I'm going to take my cuff on my first one. Put the glove on. You know, the first one is a pinch. The second one is a scoop. Then I'm going to lay my equipment out so I can see what I've got. I've got a split 4x4 and I've got intact 4x4s. Anytime you're doing trach stuff, don't cut your own 4x4. Because when we cut, we make little fibers, and this is pre-cut by the manufacturer, and that's the one you need to use. These are my replacement ties. This is my little cleaning brush, pipe cleaners, and some Q-tips. This over here has been bubbling because we've got it in the half peroxide, half saline. And so I'm ready to clean it. My patient's doing fine, got his O2 on, life is good. So I come in here and you're going to think, well, she's contaminated that hand. And that is true because I'm touching a nasty inner cannula. But it's the patient's bacteria and it's their secretions. So my hands were not contaminated. This inner cannula is, but it's with the patient's own bacteria, and that's acceptable. Clean it off. Make sure you get all the little crusty stuff off. You can even take the brush up this way. What we don't want to see is for you to step over here over your sterile field and be giving it this, flicking stuff everywhere. Really low and controlled, okay? When you're done with the brush, you can lay it down. I'm going to come to my saline. I'm going to dip it in there. I'm going to dip it back in there. Just kind of rinsing the peroxide off of there. Tap it out. Now I'm going to take my pipe cleaners. Clean. Well, it's actually drying, excuse me, I didn't mean to say clean. Drying. Could take another one. And dry. And dry. Then I want to take one of my 4x4s. Uh-oh. And I just want to make sure I get things good and dry. Okay, now I'm going to come back and I'm going to put this into my patient. Oxygen's up. And this is weird, I know, but it goes in this way, I promise. And then you twist it and it slides down into the trach itself. And then I'm going to hold again and lock it in place. At this point, you can take a really good deep breath because the sterile part is over. Whew, hallelujah. But I still have a little more work to do. I'm going to take this nasty, and it will be nasty, out, throw it in the wastebasket. And I'm going to take my Q-tips that were over here. I'm no longer sterile. I'm just relaxing. I just can clean like I need to. I'm going to put one in the peroxide. And I'm going to clean really good up under here. Stay close first and then work your way out. I can discard that or I can throw it back over here. I can do peroxide again. But I probably, at this point, if I got it good and clean enough, I'm going to not do the peroxide. I'm going to do the saline to make sure I get the peroxide off around that stoma. I don't want to break that skin down. Patient is without oxygen right this minute, so I'm kind of trying to hurry. It'll take me a 4x4. I'm no longer doing peroxide. We're just saline, saline, saline now. Got it squeezed out. It's not, you know, too wet. Faceplate's getting a good cleaning. Cleaning. Okay, now I'm going to dry. Dry my faceplate, dry up under here, dry behind here. Do the best I can to dry. Okie doke. Now, I'm going to put me a new one of these split gauzes under here. Hemostats are a wonderful thing right now because they're tiny and they can sometimes squinch back up in here for you when you have trouble with your hands being a little bit too big, which I have small hands, but I'm still able to do it. Get that in there straight as you can. Now our ties, a lot of times the ties are gunky. The thing about taking your ties off, do one side at a time and hold your faceplate while you're doing it. Put your other side tie on and come around their neck and secure your new tie. Lots of hospitals have these handy dandy Velcro ones now, which are great. The biggest thing about the last little step in this whole process is keep one hand on the faceplate at all times. Because if I take my hand off right now and I have that tie loose and they cough vigorously, this whole thing is going to fly like a missile across the room, and then I've got a patient with an unsecured airway. Hand on the faceplate. This is not the most comfortable thing for your patient, so just try to be gentle. Oxygen back on, and then there's the documentation piece. Thank you.